Thank you so much for joining us today. This is Rosa Beltré, Executive Director of the Ohio Alliance to End Sexual Violence, pronouns she, her, and ages with OESV. And today I am honored to have my colleagues from other coalitions and Camille Crary also with us as we talk about the impact of these cuts, the Voca cuts at the federal level, but also the impact of these cuts within our programs in the state of Ohio. So we have vast representation from all of the victims of crime service agencies because we do believe that there is power in our collective voices. And as we come representing our agencies and our works, we just want to amplify at a macro level the importance of all of us coming together today. So thank you for joining us. Thank you for being with us. And we are so happy that you're here. So Alicia, we will start with you. If you can do us the honor of introducing yourself, your agency, that would be great.
Thank you, Rosa, for inviting Ohio Domestic Violence Network to share about our program and our devastating impact that has affected our programs. My name is Alicia Williamson. I am the Director of Training, and ODVN is the statewide coalition for domestic violence. ODVN supports 75 domestic violence programs that serve all 88 counties. Our purpose is to support and strengthen Ohio's response to domestic violence through training, public awareness, and technical assistance, and to promote social change through the implementation of public policy.
Thank you, Alicia.
You're welcome.
Caitlin, thank you for joining us today.
Excuse me, couldn't come off mute there. It's a real pleasure to be here today and to be among you guys, people that I admire and love very much to work alongside. And thank you very much for letting me come and represent the Ohio Network of Children's Advocacy Centers, or ONCAC, and talk a bit about what some of the impacts we're going to see due to the Voca cuts as well. A little bit of information on what our network does. We represent the 29 active and ongoing CACs, or Children's Advocacy Centers, all across the state of Ohio. We actually, in 2019, served over 9,000 children, 9,045 to be precise. So those are individual child survivors, but it doesn't even take into account the number of families that individual Children's Advocacy Centers served. So there are many more lives that are touched just through those services to an individual child. Children's Advocacy Centers are very special places where child victims of abuse, whether it is physical, sexual, human trafficking, or neglect, can go to receive specific pediatric interventions that are age appropriate and can link an entire system up for ongoing healing. So these CACs work as part of a broader multidisciplinary team and help with informing and aiding in the investigation process and hopefully towards successful prosecution as well of these cases. Our role as a coalition is to provide information and support to all of our CACs and to help in the development and ongoing function of CACs so that kids in Ohio can be set up to thrive after abuse.
Thank you so much, Caitlin. Cathy, Harper Lee, thank you for joining us today. Tell us a little bit more about you, Cathy, and your agency.
Thank you, Rosa. I want to thank you again for organizing this and pulling it together to talk about this really critical issue that we're all facing. I want to thank the Alliance and you for all of the fabulous work. And again, my friends and colleagues that are on this call today, we work so often together collaboratively because it takes this collaborative team to fully serve crime victims. And it's just wonderful to be with you on this call today. And I really value our partnerships and our relationships as we serve survivors. My name is Cathy Harper Lee. I'm the Executive Director of the Ohio Crime Victim Justice Center. I founded this organization 20 years ago out of a need of an identified gap in services where as a crime victim, I had discovered that there was no place for victims to go and receive assistance when their rights were violated. And so the mission of the Ohio Crime Victim Justice Center is to provide free legal assistance to ensure that crime victims' rights are protected and enforced throughout the criminal justice process. So these matters involves things like, first and foremost, they impact the victim's right to safety, their right to privacy, which is critical, especially in this era of social media. And I can't tell you the number of cases that we're fighting right now where children's rights to privacy and children who are victims of sexual violence, their privacy rights are just being trampled on. We help protect and enforce the victim's rights to simple notification of proceedings, which is critical so that victims can exercise their right to be present and heard throughout the criminal justice process. Their right to privacy. There are just so many rights that are available that, that when victims summon the courage, and especially when all victims summon the courage, but especially our children who are victims of domestic violence and sexual violence, summon the courage to come forward, it is critical that the system works for them and the rights that they expect to be protected are. And without that, when victims' rights are violated, it just sends this chilling message throughout the system. And it really sends a message, and plenty of data now demonstrates that many victims will choose not to report as a result. So basically, it's about providing victims equal access to justice.
Thank you so much, Cathy. Liz, tell us a little bit more about yourself and the agency as a whole. Thank you for joining us today.
Thank you so much, Rosa. And it's wonderful to be on here with all of my colleagues as well. This is a time when we anticipated some devastation. We did not anticipate this much devastation. And you are correct in saying that we need to be stronger together right now as our field is changing. And it's going to take several years to recoup what we are losing. So needless to say, my name is Liz Poprocki. I'm the Executive Director of the Ohio Victim Witness Association. OVWA is a statewide coalition that represents approximately 330 members comprised of primarily prosecutor-based victim witness units, criminal justice professionals, law enforcement professionals, state systems, domestic violence and rape crisis centers, college and university advocates, and independent professionals. OVWA's mission is to promote access to safety, healing, justice, and financial recovery for Ohio crime victims through meaningful rights and quality services. We do that through providing trainings that are both approved by the Ohio Advocate Network and the National Advocate Credentialing Program. We provide technical assistance to both victims and advocates. We write best practices in collaboration with our statewide partners, and we provide public policy representation for our membership at the State House level. So very grateful to be here today. Thank you so much.
Thank you so much. And it's so important that we actually know that we're still missing some coalitions here at the table, right? And how important it is to also make the difference between a coalition and a statewide direct service provider agency in most cases, because a lot of our constituents or member-based agencies forget that from a macro level, right, we are that link to provide trainings to ensure that in locations where there is a lack of accessibility to programs or services or justice, that our organizations, by being a coalition and having the designation of a coalition, not only from a federal perspective, but also from a statewide perspective in our own individual areas, DV, SV, child advocacy centers, from a justice perspective, that we are able to go ahead and not necessarily being mediators, but just bridging the gap and ensuring that not only survivors have access to programs, but also that our advocates, preventionists, educators, law enforcers, anybody that intersects with any of these survivors or victims of crime within any of our areas of expertise, that they have the correct training that is needed from a trauma-informed and from a survivor-centered base. So that is so important. And Ohio is very unique, right? Compared to a lot of other states. And our uniqueness, besides the fact of how diverse we are, how big we are, there are 88 counties in Ohio, but 5 to 6 different regions, depending on how you actually frame those and see those. But also that we are one of the 11 states that have individual coalitions, that our coalitions are not dual or multi, but each one of us represents and does our work. We do it with intentionality, but we also respect our boundaries and our expertise, and we do it in a collaborative spirit and understanding how that is so important. So we are here today to talk at the macro level, but also understanding that we have also been affected by the cuts, right? That our programs that are doing a lot of the work on the floor have been heavily affected. But we that are a member-based agency, we are also very heavily affected. And it is almost impossible for us to be able to not only generate fundings, but momentum and also do the work with the cuts that we have actually received. Camille, I also wanted to give you the opportunity to introduce yourself.
Sure. Thank you so much. My name is Camille Crary. I'm the Director of Legal Services and Public Policy at the Ohio Alliance to End Sexual Violence. So I work really closely with Rosa. I also work in collaboration with all of the other people on the call today. So thank you so much for joining us and sharing the impact of, as you all have mentioned, these very intense and very impactful cuts.
Thank you, Camille. So as the Ohio Alliance to End Sexual Violence, we're the statewide coalition to end sexual violence. We are a member-based agency, and I think that that's important to recognize as well. There are currently 33 rape crisis centers within the state of Ohio, in which more than half of them are dual agencies, but they are also very distinct in the way that they are managed or function, just because of meeting court standards and different types of deliverable, and also understanding that there are different dynamics, right, within survivors of sexual violence, domestic violence, human trafficking, child advocacy, or any other victims of crime. And sometimes those that are in the public tend to put us all in a pot, right, or in a pile. And even though our missions at times do intersect, the reality is that the trauma of survivors of sexual violence is totally different. So there are over 2.4 million people in Ohio that have experienced some type of sexual violence in their lifetime. And sexual violence is a form of oppression that is connected to support and is supported by other forms of oppression, which is racism, sexism, homophobia, xenophobia, amongst others. We, as a statewide coalition, support all of the local rape crisis centers around the state of Ohio. We also create the core standards. We are a technical assistance and training provider for the state, and we are also here to believe survivors in every step of the way in finding the way that they want their voices amplified and the way that they define justice before their eyes. We are also providing prevention in every layer with the Department of Higher Education, as well as the Department of Health within the state of Ohio, and we provide public policy as a format of also advocacy within this work. So those are part of the things that the Alliance does. So as we're talking about Voca, Camille, can you define what Voca is? Tell us, and then we'll ask the others how that Voca actually impacts, because people might not know what Voca stands for and that designation.
Absolutely. Thank you for asking that. So Voca is a fund that was created in 1984 under the Reagan administration. It was an innovative funding stream at the time. And when you look at all of the collaborative streams that our agencies rely on, it is very unique to this day. It is not taxpayer based. So Voca stands for Victims of Crime Act. And the Victims of Crime Act grant is primarily funded, and I say primarily, and you will hear, I have a 1-year-old and she is home with me today because she got sick on the way to daycare. So we are working with that. You probably couldn't tell that I was throwing snacks over to her high chair. I was restricting my.
Sorry, Camille, but we lost your audio again. No problem. And as Camille comes back and defines that, as she was mentioning, the impact of Voca, where it actually stands from, and knowing that Voca in itself is not funded by taxpayer money, right? So that is so important to understand those dynamics, and that most of our agencies rely, 90% of their funding comes from the Victims of Crime Act, 90%. And that for many of our agencies, it is impossible to fundraise that amount of money for the sustainability of their programs and for the support that they provide survivors.
Thank you for covering that, Rosa. I was just going to add that you mentioned it is white collar crime fines that are used to pay for this. So it inevitably changes every year in every administration based on how many crimes are being prosecuted at the federal level and how many of the fines are actually being aggressively collected. Because for those of you who are involved in white collar fraud monitoring, or involved in this grant in some way, that those don't automatically always get paid in the way that we would like. And there are also still civil damage awards that are involved as well. And so it shifts and has ebbs and flows throughout administrations, but we'll probably get.
We lost you again. That's fine. So we will go ahead and continue in reference to that. Thank you, Camille, and we'll get back to you. Alicia, how has ODVN been affected by the current cut of Voca for your programming?
Unfortunately, many of ODVN's member programs have had to cut or eliminate staff positions, services, programming, and reduce budgets for their internal supports they offer to survivors and children, which can contribute to their well-being, like their food, their personal items, and youth activities. Due to COVID, fundraising events which support these efforts have been canceled or restructured, which have contributed to great losses for our DV programs. ODVN had to cut the relocation and legal assistance program, which exists to support programs assisting survivors. The relocation program took a 39% cut, while the legal program was cut by slightly more than 39%.
Thank you. Caitlin, how did you see the Voca cuts affecting your organization as a whole and your member agencies?
I think that I would first like to echo the note that Alicia made about how many victim serving agencies receive such a massive portion of their funding through the Voca grants that it is exceedingly difficult for many places to fundraise enough to make up those gaps.
Mm-hmm.
What we saw kind of across the board is the unified, roughly about 37 was the baseline. And then in reality, that came out to sometimes as much as 40 or more % for many agencies that saw a loss of those funds. Where we see a lot of impact apart from the lack of ability to make up for that in fundraising, which of course, most places couldn't have in-person fundraisers this year due to concerns about health.
Mm-hmm.
And then apart from that, we also have a very broad range of our member agencies. There are some agencies that are really big and fairly well established, but there's also many that are new with smaller staff. Also, I think that sometimes we tend to think about Ohio as a cluster of several major metropolitan areas, and we don't always necessarily think about how we stretch everywhere from the Great Lakes to the farmland all the way into Appalachia.
Yes.
So when we think about the ways in which everyone is going to feel these cuts, we might have folks who are in rural areas who might have been able to receive consistent and ongoing advocacy services and help that may not be able to receive some of that same level of service because of cuts due to Voca. Because we also want to make sure that staff are compensated consistently and fairly for the huge task that is before them. When it comes to us as a coalition, we are still moving forward with a lot of initiatives that we had planned, but of course we're making reasonable cutbacks and trying to do more with less, but also staying focused, because our number one priority is to ensure that children and families receive the help that they desperately need at an incredibly traumatic time in their lives.
Thank you so much, Caitlin. Cathy, I know that within your agency, those cuts might look totally different, or the coalitions that you represent, but even from a law enforcement perspective and prosecutor base, we've also seen that there has been huge cut, right? And within the systems as a whole. Tell us a little bit more about how the Voca cuts have impacted Ohio crime victims justice, as well as some of the programs that you represent.
Well, and so to start off, no, we're not a member organization. We are set up member-wise. I would say, I would maybe more describe us as, we work closely with the National Crime Victim Law Center, which is a national organization. We work very closely with them. Since the whole concept of victims' rights enforcement is rather a new and emerging concept, I say new and emerging, although I started this organization 20 years ago, NCVLI started 20 years ago, New Jersey Crime Victim Law Center started over nearly 30 years ago. But you all know what I mean when I talk about new conceptually new, because change takes time.
Yes.
And so when we're looking at 30 years and change and getting the system to understand and respond to the simple notion that just as everyone else's rights need to be protected and enforced, gosh, so do victims. So we're not a member agency as far as having other members throughout the state. As you all know, we work closely with other organizations when we're working on cases. We work quite a bit with ODVN on a lot of cases, and then when there are collateral legal needs that come into play. Going back, we're a direct services organization. So we are statewide, but we are direct services. And as you were talking earlier about training is absolutely part of our mission as well, and is what we do. We provide training for advocates and law enforcement and prosecutors and judges and all other allied professionals that work in the field. And we provide CLEs and have accreditation through the Ohio Supreme Court and the Marriage and Family Counselors, CEUs. And so, because it's about systemic change as well, yes, right? And how do you get to the root of systemic change? And that is working within the criminal justice system. I can say for our organization, I'm really happy to say that we have trained in the last 2 years over 4,000 criminal justice officials and a number of judges. So I am happy to see, because initially when we started, I think initially when we started providing training, I swear within 8 years, we had maybe one judge show up for training. So now we're seeing, with the support of the Ohio Supreme Court, we're training the Muni Court judges during their national conferences, and common pleas court judges and retired judges and visiting judges, and we're getting an opportunity to do that. So again, those things hoping to work towards systemic change. But the bulk of what we do is that direct service to crime victims and providing them that desperately needed no-cost legal representation. That being said, and I won't even go into some of the examples. I'm not certain who our audience is here, so you all know what that means. If there are advocates on the call, most of you all know what that means. But there are, like, if victims, if defense, or somebody's trying to make victims turn over private, privileged, confidential information, that is protected, and victims have the right to refuse. And we can provide free legal assistance to say, no, we're not. That's you're going to have to at least go through the proper procedures, have a Nixon hearing, determine if the information you're seeking is relevant, when the majority of the time, all of their counseling records, prior medical records, computer hard drives, cell phones, all of this private information is not relevant. So there are privacy matters that we protect quite often, but amongst a number of other things, and especially now the right to be present during COVID and what that means. And we're seeing issues across the state regarding victims having access and being able to exercise their right to be present. So, which is another issue. That being said, our funding was cut by over a third. And those are direct services to crime victims. Mm-hmm. And as this organization has been growing and ramping up, the passage of Marsy's Law in 2017, of which, you know, over 83% of Ohio voters made it very clear that that victims' rights were important. And though many of those rights then were elevated to the level of the Constitution, it was clarified in the Constitution that victims have the right to counsel to protect and enforce their rights, albeit the state doesn't have to pay, but still that concept, we were always arguing, you know, that victims had the right to protect their rights. You know, they had the right to bring an attorney in. We always had to even argue that, clarified that, and the right to restitution. But since that time, we have seen our number of people calling us in desperate need of assistance has risen over 271%, mm-hmm. just in the past 3 years. This year alone, we went from the year prior to 745 cases to 1,035 cases this year. And I know in some contexts you may talk about the number of victims served, but for our organization, Legal Services, a case is complex.
Yes.
And a case requires a lot of time and energy and work and legal research and gathering of all this information. Up to 1,035 just this past ending grant cycle. Well, and with our predictive growth, based upon the percentage of increase each year, we're looking at the possibility with this 1/3 reduction of potentially having to turn away over 620 crime victims. And what that means, I mean, and with the funding cuts all over the state, there's no place for them to go to get assistance. And you know, and it's horrible that victims will not be receiving these services, or may not be able to receive these services. But on top of it, many of these cases are precedent-setting cases, right? Because we're in this new era. We're setting case law. They're precedent-setting cases. And they're also critically important cases because they help to ensure that future crime victims may not suffer future rights violations. So victims are going through pain and suffering of not getting the services they need. We're losing some of these critical cases that could set great precedents, you know, so that future crime victims don't suffer. So those are some of the ways that we're being impacted, but the people we serve, we fear will be impacted.
Thank you so much, Cathy. Liz, tell us a little bit more about the impact to your organization as a whole, as well as to the member agencies, because you are in a unique situation. Most of us are members of OVWA. As a coalition, most of our member agencies or our collaborative are members of OVWA. So what does that mean for your organization and the member agency?
Yeah, so a lot. And we'll start with what you just mentioned. You know, OVWA, we are brand new, but also old, right? So we've been around since 1976. So one of Ohio's oldest state-based advocacy organizations that has birthed huge legislative milestones in the state of Ohio and many organizations that are standing today. So as OVWA, right, we're an older organization. However, we've only had Voca funding for 3 years. So we received our first Voca grant to open a state office in 2017, in which myself was hired as well as another staff person. Due to a government shutdown and a pandemic and the loss of Voca funding, we've been very limited on how we can grow our organization in the last 3 years. It's been much slower than I think what we ever anticipated because of those restrictions. And as we look at how we're going to continue, you know, 95% of our income is Voca. We also have a very small pot of JAG funds for one project. The other is membership dues, and we bring in about $7,000 in membership dues a year. The cut of the Voca cut is now going to drastically impact that membership fund that helps fund a large portion of our services and subsidize some of our programs. So we know that with the Voca cuts to our membership organizations, a lot of them are not going to be able to afford our membership dues, which are already quite affordable considering what we provide with monthly and quarterly trainings and the product that they're given. So we know that that is going to impact us drastically. Us at OVWA, we took a 40% cut. We've already had to lay off a staff person. So we went from 3 to 2. And in the past 3 years, we've grown OVWA, the 3 of us had grown OVWA to be a primary resource in the state of Ohio. And now we really have to reconsider and restructure what we're going to look like with only 2 people. It was a lot at 3, but now we know that we really are going to have to reconsider a lot of our participation and a lot of different initiatives now. So for us, we've also had to lose some of our offices. So we've had to take a huge hit with a 40% cut to our Voca, our primary funding source. I know for our member organizations and for OVWA, they were already decreasing their programs already. So they had already received a 7% decrease the year prior to this in their funding. And then we were expecting a 20%. It came out to be much more than that for our membership organizations, as you all know on this call, and probably some of you also know who are watching this. So, I mean, by the end of 2020, we are expecting a 57% decrease in Voca funding for the state of Ohio, really for the entire country, because this isn't something that's just affecting Ohioans. This is affecting victim services across the United States. In understanding that people were already cutting back, already streamlining services, this obviously is impacting our membership organizations and making further cutbacks that they were not expecting. So we have already heard back from a handful of our membership organizations of their decreases and their downsizing, both in prosecutor and community-based programs. And we expect to hear more at our October 16th quarterly membership meeting, where we are holding just space because people need to process what we're going through right now. How this is affecting prosecutor-based organizations. So knowing Ohio, 88 counties, a lot of rural counties. Most of those rural counties have maybe 1 advocate to serve the entire county, or even a part-time advocate that is going to serve that entire county. So the larger counties in the larger metropolitan areas are obviously going to experience cutbacks. We have to keep in mind too that prosecutor-based offices are not eligible to receive foundation grants or anything like that. They are also the advocates in the state that have no line item in our state budget. So there is no security going into these Voca cuts and decreases. So what we are expecting is that many counties are going to have to downsize in a time where they most certainly can't afford to with the amount of victims that they're serving. And that I'm definitely worried about those smaller rural prosecutor-based offices with already 1 advocate and what that's going to look like for them, especially as and I know that we'll talk a little bit later about the impact a little bit more, but, and we'll get into that later, but this is drastic. When you're talking about court mandated, there's legal mandates for what these advocates and prosecutors' offices must be required to do.
No, definitely. So it's so important that you put that in context and understanding, because sometimes people also don't understand community-based advocates or advocacy-based as prosecutor-based advocates. And even within such a large state, 88 counties, right? Many from a rape crisis prevention and aspect, there are 33 rape crisis centers for 88 counties. We still have currently 13 counties that have not have a local rape crisis center that can provide them with services within a 30-mile radius, right, or 30-minute radius. We have 88 counties, 75 to 76 domestic violence centers, some with shelters, some with not, right? We have just 25 CACs in 88 counties, right? So understanding those dynamics of response, timely response and timing, and understanding those layers of service, that there are still, even when you mentioned that there are counties that only have one, and that's a prosecutor-based advocates, there are counties that have zero community-based services. There are counties that have zero sane nurses in their hospital. There are counties that don't have a shelter with actual beds, right? Or a stay-at-home shelter. So understanding all those dynamics, or there are counties that don't have any CACs, and it takes time to commute, to process who's going to take care of those forensic child investigations and having the expertise. And there are counties, Cathy, that even with the representation and understanding that victims do have rights, that unfortunately, even before COVID, were still, their rights were not being respected, right? That you had to reschedule, that they were not being heard. So many dynamics in understanding these components, right? And the reality is, when we look at the cuts of money from last year, $111 million, to this year, $55 million for 367 programs within the state of Ohio. It's dire, right? And when communication started, even if we forecasted, it really did not matter how much we forecasted. We were not ever expecting this amount of cuts and devastation as we look at them, because it is gut-wrenching. And in the midst of not only COVID, but civil unrest that we're in, and all of the needs, it continues to add layers of systematic and institutionalized oppression, right? Even as we want to do this work in a very holistic approach and understanding, but it seems that we are going back 20 years ago, 20 years of services, starting from zero. And when you say that your agency first, right, and even with funding and all of that is not enough, how difficult it is. Liz, I want to go back to you, because in March, when we started having, March 2020, actually we started having these conversations last year about the impacts of the cut. But in March, your agency generated a wonderful survey provided to all of the victims of crime agencies that were part of your member-based agencies. And many of us also sent it out, so there was response. And it seems that that report forecasts and tells us the reality of what we're living now. And that was in March, right? And questions were very well thought and asked with intentionality, so that we can, before the cuts happen, before the funding being there, we could give a snapshot to the Attorney General's office of what would these cuts actually mean. And that was forecasted at a 20%, not at a 43%, not at a 50%, at a 20%. So Liz, I don't know if you have the survey or the report with you. Can you tell us a little bit more about some of the response from the 68 programs that actually did participate? What were some of the comments of the respondents and the aftermath of these Voca cuts?
Yeah, absolutely. So yeah, it was the fall of 2018 that we started to have these conversations. And then we started to realize that we needed to start to get ahead. I started to hold conversations with senators and representatives about what we were going to be expecting and some of the fears that we were having. It was in March 2020, yeah, March of this year. Wow, of this year that the report was sent out. Obviously, time is a whole different issue right now in 2020. So thanks for bearing with me. But yes, so in December 2019 through January of 2020, OVWA spearheaded a statewide survey, and our coalition partners and everybody on this call today was a part of getting that out to their member organizations and their constituents as well. And what that did is it gave us a snapshot of what is currently happening within organizations, advocacy organizations across the state of Ohio, but then what would happen with Voca decreases. So here's a couple things just to give you a snapshot. So of course there were only 68 Ohio programs that completed their survey out of, we know, well over 350 that at the time were receiving Voca funding. So there's a lot of people that we also couldn't reach, but this gives us, I think, a really good snapshot and a sample size of what we're experiencing now, just like Rosa said. So we had 29.41% of domestic violence shelter programs respond, and we had the same amount, 29.41% of prosecutor-based organizations respond. The other organizations that responded were community-based victim programs, rape crisis center programs, post-conviction victim programs, child advocacy centers, CASAs, which are a court-appointed special advocate, sorry, and other underserved population, such as disability, university, and minority population advocates. So out of that, we had a really good response about what was going to be missing. And here's just a couple quotes and some feedback, but 41% of survey respondents reported that they already cut staff or would have to cut staff. So almost half. And then what that cut would be looks like human trafficking advocates, rape crisis center staff, hotline staff, court advocates, intake specialists, CASA coordinators, medical advocates. These are core direct services. And ironically, that's what the whole grant was about this year to be funded, right? Is to fund those direct service positions. The respondents did say, if we get any more cuts, we will simply have to close. There's going to be less services for more and more victims, because we know victims don't stop coming to your doorstep.
No.
It's going to keep happening. Voca funding is critical, and our DV shelter's second and third shift staff will have to go. So you're talking about second and third, you're talking about afternoon and nights. DV doesn't stop at 5 o'clock in the afternoon. This stuff keeps going. The underserved will not be able to receive services. We see that a lot in underserved populations. They're already receiving minimal funding, and any more cuts to that means an elimination of it. Those services that provide services to disabilities, victims with disabilities, victims of minorities, victims to immigrants, immigrant victims, these are critical services and critical populations that are going to be threatened to go without services. This one program said, our program is 99% funded by Voca. So with that cut, you can already imagine what they've lost. Services will be superficial as the number of victims increase and the number of staff decreases. And that made a really good point, because I'm always one of quality services over quantity. And when we're talking about a decrease in services, and we know the number of victims is going to increase and going to continue to increase over time, we also know that the quality is going to decrease. You're just putting out fires by that point in time, and true trauma responsive services are going to go to the wayside. And ultimately, the biggest one was our community is going to be impacted. I think that people forget. They hear, still, I'm going to go a little bit ahead of you, so I apologize, but I'll be quiet here in a second. But victimology is not just to the person that was victimized. This is an epidemic within our communities that affects our entire state. And trauma is not something that just happens to an individual. It happens within your community, and it affects your community. And I think sometimes these are taboo topics to a lot of people when they need to be more commonly talked about. And that because anybody at any time can become a victim of crime. And to know that in your moment of need, you don't have what you need is devastating. And when we are unable to provide to victims of crime, we prolong their traumatization, and we prolong the victimization, and we prolong access to healing. And that's what's happening. That this was a wonderful snapshot to say, without these services, your communities will suffer
Yes.
because they're going to continue to go without. So I hope that answered your question. I kind of got on my soapbox there for a second. But
No
thank you for asking it.
soapbox. Yeah, no soapbox at all. You know, as I mentioned before, it's not only the Voca Fund. This year, and many have said, we won this year over, right? And we know that the civil unrest and COVID and how it has impacted. But what people tend to forget, that even in the midst of all of the numbers and lives lost over COVID, violence has not stopped, has not deterred, right? On the contrary, it has increased in numbers that we have still yet to collect, because we're still in the midst of the year, right? We haven't been able to collect. We're in the final quarter and understanding. So, Alicia, October is Domestic Violence Awareness Month, right? And you guys just put out a fatality report for the state of Ohio. Did domestic violence stop during COVID? And how is the Voca funding affecting the way that the 75 programs within the state of Ohio of DV are able to provide the services to those affected the most?
Rosa, that's such an important question. It is important to note for our audience who is listening to be aware that programs suffered a loss also last year. And DV programs struggled to maintain and sustain their programs. And the core of Ohio Domestic Violence Network work is to foster change in our economic, social, and political systems, and bring leadership, expertise, and best practices to all of our programs. Voca funding is the primary funding source for many DV programs. But Voca funds support multiple staff members and program services. And without this funding, programs will have to reduce or eliminate staff, reduce level of services, or even eliminate some service altogether. Programs will not be able to provide the same level of service provision, which directly impacts the safety, security, and well-being and independence of survivors and their children. The loss of staffing and services may leave survivors questioning if they would be better off staying with the abuser or returning to an abusive environment. Many domestic violence programs will reduce staff time or eliminate completely child advocate positions, which will directly impact a child's transition to shelter, trauma processing, sense of safety and security, healing, stability. A few programs lost half, 3/4, or all of their Voca funding. It was just a devastating loss, as you all have said. Our legislators, community partners, and funders are our source of strength through this trying time. We all have the power and influence to bring about that change, and we need the support from everyone now more than ever. I do want to talk about the report that was just released, our fatality report that was just released this past Tuesday, which was just so alarming. That report had stated that it counted 109 fatalities from July 1st, 2019 through June 30th of this year. That's about 35% higher than the total reported last year. History has shown that domestic violence tends to increase in the aftermath of disaster. The COVID-19 pandemic, which led to stay-at-home orders and deep economic distress, likely is contributing to more violence. During the first few months of COVID-19, domestic violence fatalities were 14% higher than during the same period in 2019. And this alarming statistic is the second highest since the coalition started issuing the reports 5 years ago.
Thank you so much, Alicia. Caitlin, what has been the impact of COVID and the cuts for children that experience violence within the state of Ohio, and also understanding that stay at home and also schools closing when they did, or even now being remote, is not always the safest for our young ones?
Yes, I truly appreciate you bringing that point up right at the top, Rosa, because that was exactly something that I was going to state. All of our work collectively is so deeply and intrinsically linked. When we talk about the co-survivorship of domestic violence, sexual assault, and child abuse, we are a lot of times seeing entire families within all of our networks together. And when we're talking about how home is not always the safest place for everyone, it is not always the safest place for our most vulnerable folks. What the stay-at-home orders have meant for children living with abuse is that they essentially had been kind of losing a lot of that outside contact that they might have had, to where they could ask for help, to where they could ask for support. Many younger children have been learning to navigate social media and technology in a completely different way. I know that my stepson didn't really use his computer time for schooling before. So this has been a very new adaptation for not only younger kids, but for teens as well. So as we're looking at the way that kids have adapted to pretty much being online 24/7, using it for school, for their social outlet, you also see abusers who are becoming more and more savvy with the techniques they utilize to groom and exploit children. So while we may have not seen initially the same number of children coming into CACs, because also I'm not sure how aware the general public is that rape crisis centers, DV shelters, prosecutors' offices, legal entities, and CACs, we've all been open this whole time and seeing clients and helping people. All of our centers collectively have not shut our doors. We have done all of this on reduced staffing, increased cleaning and health protocols. And many times, I think that we mentioned earlier that there are only 29 CACs throughout the state of Ohio, that every child, even if they are able to drive in and access a CAC, they will not be turned away. So this can mean that children from far-flung areas are coming to receive services at these places, and the staff is having to provide very emotionally intensive services to traumatized families and children. And now we're facing the prospect of having to cut back on hours, possibly on staffing. The impact of the cuts is almost too deep to truly articulate, especially as we are navigating this post-COVID world where we're seeing abuse take new and different forms, where we are seeing the specter of disease and ill health impact us in a very direct manner, that we have to increase the already high standard of health and safety that we present in all of our centers, which does not go without cost. In order to recirculate air and purify air and purchase purifiers, in order to purchase increased cleaning goods, personal sanitation equipment, personal protective equipment, all of that is a monumental undertaking, even if we were fully funded at levels from several years ago. I think that we will always serve children and families, but the undue burden that is now placed on frontline workers and staff due to cuts like this, it is truly difficult to really to say or to even process, but it is tremendous.
Yes, and even to quantify, right? So when we as a coalition for sexual assault and sexual violence have the conversations with direct service providers as well as the rape crisis centers, it's more than just programming, right? And the reality is that a lot of our advocates, even though they were not considered essential workers, by mandate, right, continue to still work, right? And they were not receiving hazardous pay. We couldn't have volunteers participate, right? And we were still asking advocates and programs to provide so crucial services to survivors in the midst of a pandemic, right? In the midst of the crisis and navigating and them experiencing that also. But we also have to understand that more than 92% of those of us that do this work are survivors ourselves. And this has been triggering for many doing this work, right? The amount of work, the exhaustion, right? For us as a coalition, we have been nonstop since March 18th, right? Indistinctively with collective conversations, crucial conversations, the services, the support, the let's get more funding that it's needed, or COVID, or preparing, or people needing to go ahead and update and change their employee handbooks, and understanding and supporting the advocates, and talking to preventionists of how are they doing this work now in already victim blaming culture that does not have a particular curriculum in the schools about sexual violence or healthy relationships, and you have to sugarcoat a lot of the conversations about what it is. So what is a priority? And in already cramped and zoomed out space, are you going to be able to facilitate those conversations and support teachers and students and understanding those navigations? So our agency as a whole received a 48% cut. We as an agency also are unique because we do the macro level work, but we also provide direct services through our legal services that we do have at OESV. So we have an area just to provide legal advocacy, accompaniment, support, having base also to find attorneys that will take on these cases. We've seen retaliation for Title IX cases. We've seen increase in everything that it's needed. And we had to cut that with these Voca cuts and try to find funding elsewhere. As a training provider and technical assistance, all of us had to go ahead and change our platform, right? Because everybody was like, everybody's going virtual. We still don't know. We haven't had in-person trainings, but that doesn't mean that the trainings have stopped. That doesn't mean that the production of best practice models has stopped, right? And ensuring that people receive the information. So none of us as coalitions had platforms for Zoom that were within our budget, right? Operation budgets, or webinars that now would allow videos. We even had coalitions and programs that were still trying to help them fund getting a laptop that has a camera that works, or audio to be able to do. That is the reality. And not only that, going to telehealth, teleadvocacy, telecounseling doesn't work for everybody because there are locations, as you all mentioned, that from the Great Lakes to Appalachian, that there are no hotspots, that there are no broadband, that no matter where you're at, you're still searching for signal, right? So when we talk about accessibility and able to serve, these cuts continue to hinder survivors, continue to hinder our organizations, and continue to hinder the most affected and marginalized of all, right? So when we're talking about these cuts, it's so important to understand, even within the dynamics, I asked for a report and I wanted to share with you because I think that it's crucial for people to know how were we cut, right? And from where. So Northwest region, that is Allen County through Wood, receive a 40.51% cut in Voca cuts this year, which equates to $4,687,684. Northeast when we talk about the metropolis, right, and Cuyahoga County and everything that that means, that's anywhere from Ashtabula all the way to Wayne County, received a cut of 42.90% in services. In dollar amount, allow me to say that number because I was shocked. $16,362,435. That's how much 42.90% of the cuts in the Northeast region equates to in Voca cuts. And that includes our coalition, that includes the Cleveland Rape Crisis Center, that includes DAVC, that includes CAA's, services, prosecutor-based agencies within Cuyahoga County, Columbia, Carroll, Ashtabula, Stark, Summit, Tuscarawa, Waynes, right? That was the most affected and hard-hit region in all of Ohio. Central Ohio received a cut of a total of 43.66%. Second region that received the highest cut with a dollar amount of $10,803,000.93. That is where most of your coalition agencies is your home base located at, and most of your services. That goes from Crawford, Delaware, Fairfield, Franklin, Knox, Lincoln, Logan, Marion, Monroe, Muskegon, Pickaway, Union, and Wyandotte counties. That's the amount. And we have Southwest region from Brown County to Warren County, including the Cincinnati area, Montgomery, Miami, Hamilton, Greene, Fayette, Clinton, Claremont received a 42.89% cut at a total of $7,367,963. Southeast region, from Athens to Belmont, Gallia, Washington, Noble, Morgan, that Southeast region, Appalachian, no broadband, lack of services, handful of programs, right? And community-based received a 37.5% cut with a total of $1,478,578. This gives us a grand total within the state of Ohio when we see within this Victims of Crime Service Agency of a total of $40,699,753. So out of the $111 million that we received last year, right? And this year we only received $55 million. Our victims of crime programs, the ones that we all represent and that are here today, received a total cut in Voca of $40,699,753. So I just wanted us to hear that number, right? Let it sink in, because sometimes people don't associate what those cut means and what it actually entails and understand. So, and it is devastating, right? And so sad that on a Friday evening, these are the news that we're talking, but it's so important, so critical. These are critical conversations. These are critical times. And the time is now, Ohio, right? As member agencies, as advocates, preventionists, our constituents, for those that follow each one of our pages that understand where we're at and why we need Cathy. The impact of these cuts, right? There is something that Ohio needs, and that is Marcy's Law, right? So with the impact of these cuts, how much more difficult will it continue to be for us to advocate and ensure that these things get done? Tell me a little bit more about that. And if you allot me 5 more minutes, we'll be wrapping up after this so that we have a call to action today.
Well, and I think, this is kind of, as Liz and I talk often, right, and how this impacts prosecutor-based victim service organizations, how it impacts actually law enforcement, prosecutors, courts, custodial agencies. They all have duties to crime victims. And yes, with Marcy's Law, now I'm going to make one thing clear here, though. Many of these rights have been in place for over 25 years, right? And they've been ignored. elevating them to the level of the Constitution, but a great deal of attention to the matter. And there was a great deal of, I think, awareness brought through with a lot of the actions of the media as gearing up to Marsy's Law. So that created a great awareness. And I'm going to that piece too, because when there was a lot of money put into the press to inform people about their rights, when you had that ability, right? You're talking about people who don't, so for a period of time, people began to understand, wait a minute, they hear it broader. Do I have rights? So here's what it's going to do. It's cutting. And as you have all talked about, so we're cutting services in these critical areas. As Liz mentioned, these criminal justice entities have a duty and a responsibility pursuant to the Ohio Constitution to do many of these services. For the notification for all of this is a big burden on them. One thing. Secondly, then being decreased, and the crimes are still happening. They are increasing. The victims are still coming in, and all the staff is becoming, all staff across the states becoming overburdened. And you talk about quality of services, and that's declining. So just service delivery in general, let alone, we were gearing up to the point where more and more people were becoming aware of their rights. And guess what? That's going to begin declining significantly. And you talk about going back, Rosa, 20 years, we're taking massive turns backwards. More victims are less victims are going to be aware of the right. I mean, how was I saying this?
Mm-hmm.
Victims are not going to be aware of their rights. And of the cases that do come in, and of the victims that we can serve, and as we represent them in court, I mean, it's a total nightmare. And it's the crime victims who suffer. It's our community who suffers. And it's all of us, actually. I'm going to say it's the criminal justice community. It's all of us victim service providers. Most importantly, it are the crime victims who are suffering. But yes, they're going to be we're sliding back rapidly.
Yes.
And victims are suffering.
Thank you, Cathy. They are, right? So we already know that victims or survivors, whichever connotation, normally from a survivor-centered or community-based agencies, we tend to call them survivors. And from the legal and prosecutor-based victims of crime, right? But the reality is that whether they are from domestic violence, sexual violence, or child advocacy centers, those are the most underreported crimes, not only in Ohio, but in the United States, especially victims of sexual assault, right? Because it comes accompanied by shame, by guilt, by additional trauma. We also understand those dynamics of even supporting those survivors at many times in these times specifically, right? Where we have a pandemic, when we have people afraid, when everything that we hear on the news is not yet, or we're seeing the hype and the pipe because people are not practicing social distancing or putting on their mask. A lot of the survivors that we encounter and had, all they said was, I don't feel comfortable going to the hospital. I'm not going to the hospital. But that doesn't mean that the crime did not occur. Just because the crime was not reported, right? Because people might not feel safe, or people might not have gotten to the hospital to have a lethality test or to go ahead and get a rape kit done, does not mean that the crime has not occurred. Just because there was not a forensic interview or a detective involved, or law enforcement was not involved, because of different dynamics that might be, once again, fear, education, legal status, different dynamics, right? Does not mean that the crimes have not occurred. So when we see the decrease in these fundings, it continues to tell survivors, we do not believe you, right? Fix it on your own, scramble whichever way you can. And we find all of us trying to find different forms of supplementing operational funds for our organizations to provide the minimal. We're not even being innovative. We're not even expanding. We're not taking this off the pad. We don't even have evaluators and bringing in research and all of that. We're doing the bare minimal. And even that, for the marginalized, underserved, for our communities, for survivors, that is not enough. Programs not only have to cut advocates, preventionists, the amount of hours of volunteers that they are able to offer, but counseling services also as a whole. And even fundraising, when you have an organization that is 93% or 95% or even 70 or 40% Voca funded, right? And I will say from our end, I'm not even Voca funded in my position, and I do so much, right? Because we couldn't sustain it. We could at all. I've never had my position or any of my work from a Latinx perspective, an intervention perspective, or coalition based, because our Voca funding would never support that. So we always took it to the core of what it was, right? Many of our organizations, right, are not even being supported in the basic of what it means. So they have had to cut counseling services, they've had to cut programming, expansion. So when we talk about that, there are still counties that don't have representation, and representation does matter. A presence does matter for accessibility and having there. If you had a call to action today, if you had one word, or multiple can be before that, to legislators, to the federal government, to your community-based agencies, to survivors, what would it be? And I know that each one, the way that we would interpret that could be totally different, but from our end, and then I'll have your end, we want survivors to know, those that are hearing us today and will continue to hear us, indistinctively of these cuts, our programs are committed to your well-being. We will do even when we can. We will find even when we don't have. We will continue because our mission is to eradicate violence in the state of Ohio. So we will find a way, even if it's not sustainable. It isn't sustainable. So we want survivors to still know, yes, this is dire, this is heavy. There might be areas that might be cut, but I assure you that if you reach out, you will be heard, believe, supported. We will figure out a way to ensure that you have the services. Liz, if you had some words, what would it be in that call to action?
How many words do you want? I think Alicia understands that. I think ultimately Ohio has a responsibility. We have a responsibility to care for our own who are harmed in our state.
Thank you, Liz. Alicia, what would it be?
I'm sorry, I have a little bit more words than that, but just give me 1 second. There are legislative fixes to the Voca Fund, which could stabilize the funding in the future. We are urging our legislators to support these fixes. It's a no-cost, urgent legislative fix. Our plea is for Congress to amend the Voca statute to direct penalties and fines from non-prosecution and deferred prosecution agreements into the Crime Victims Fund. We are also asking our senators and representatives to increase the state item for domestic violence from 1 million to 5 million. Thank you.
Thank you, Alicia. Caitlin, what's your ask? Call to action.
I think I've just got a pretty brief one. To survivors, we are here. To our legislators, we are here.
Thank you. Cathy, what is your call to action?
First, to survivors, I wish I could make that ultimate promise that every survivor that contacted us, that we could give them assistance, but that is just no way a reality to us with such drastic funding, because we only have so many attorneys that can provide this no-cost legal assistance and advocates that can support them. And we can only take on so many cases. I'm going to tell you, and you all know, I know you all know, and on here, that when you have to turn somebody away and you have to look at how you're prioritizing cases, you have to prioritize, and coming internally, prioritizing who you're going to help is the most, it's horrific on the individuals who are working in this field to make those terrible decisions. So I am going to say that call to action, Liz, that you said is our state step up, our legislators step up. And Alicia, as you said, the, Attorney General Yost and all governors made this plea to Congress to make those changes that are a fix and that they can be done, and to, you know, members of Congress to urge them to do this. Absolutely. And for Ohio and for the Ohio House and Senate to also support increasing from 1 to 5 million to help sexual violence and domestic violence victims. And then also, I'm going to call it out here too and make it a step further. Ohio needs to step up and make sure services there to protect all victims, victims of assault, survivors, you know, homicide family survivors, all victims of violence, that we just need to step up and take.
Thank you, Cathy. Camille, what is that call of action from a legislative perspective? What do we need to do? How do we need to do it? And how can we support it?
Absolutely. Thank you so much, Rosa. I am going to probably have a co-host here, a little bit of background noise, so be ready for that. She has a lot to say. But this is something that, you know, we are in the middle of a very politicized time frame right now. And so there are some arguments I think that might come up or might enter people's minds. So I just want to explain the very framework that we're dealing with and why it is so critical that the government make this money available to us for these purposes. So like I started to say before, Ronald Reagan started this fund. This fund sculpted the crime victim services that we have today. There are not 6 programs represented on this call right now because 6 separate people thought to themselves, this might be a really good idea, we should do this. No, the government decided in collaboration with activists that this was a critical, essential service. So for as long as the government has been funding social services in this country, they have delegated those, for the most part, to nonprofit organizations for a couple of reasons. One, they know that local communities have local experts. It's more efficient and effective to have those people providing services to constituents. 2, content experts in those communities are going to be cheaper if they are grant recipients or federal contractors than if they are fully funded federal employees. So this is a long-standing arrangement. If the Voca Fund had not been created and the government hadn't identified these specific forms of social service, none of us would be sitting here right now. We would all be doing other things professionally. So we are not independent agencies that have become reliant on a fund that we are now asking for after that fund has run dry. That is not what's happening. We are here because the government relies on us to provide services that they identified a long time ago as being necessary for the people who live in the communities that they govern. So we are a creature of that. And now what frankly is happening is we are being told to find other funding streams. So we're being told to provide a service that the government cannot afford to do on its own without any support from that government. They're basically saying, we created you, now become self-sufficient without us, when we have no impetus to do that. I mean, we are not for-profit agencies. We get no benefit financially from doing any of this. This is us providing a government basically mandated service, which is essential and absolutely necessary. So right now, we are in the phase of the budget where we're looking ahead for advocacy at the next federal budget term. So my first call to action is in collaboration with everything you all have said, is to call your federal lawmakers. Call those, if there are any, that are not up for re-election or have a very safe seat. Call them right now. Find out where they're at, tell them what you want. Call the people that are up for election or have a highly contested seat, tell them what you want, find out where they are on those issues. If you communicate that to them now, they will know going forward that this is where you stand. And then the second that election is over, start calling your lawmaker and make those direct asks. Do it again in January, do it again in February, do it again in March. In March, we will be having meetings with federal lawmakers about the budget. At the state level, the state of Ohio has been benefiting from this federally funded structure for a very long time without creating those separate independent funding streams. So they're basically getting all of this for free. Now, in the last 6 or 7 years, The Rape Crisis Centers line item was created and funded. The Domestic Violence Centers line item, though, was not funded until later, and that is not acceptable either. So we have two independent funding streams, the Rape Crisis Centers line item and the Domestic Violence line item. Those line items need to be increased. That is not a full solution, but we need an increase now, because if we don't get it, we might not make it until the next fiscal year with the structures that we have in place now. So we need to know that that money is going to get increased, because the state government is benefiting from this structure as much as the federal government is, perhaps more. And as we have talked about, we passed Marcy's Law in Ohio. There are other bills impacting crime victims that would increase the need and the demand on prosecution-based advocates, on law enforcement-based advocates, on community-based programs, without giving us any additional funding with which to provide those services. And a lot of you have mentioned, and Rosa has mentioned, OAESB has direct services. So my team within OAESB provides direct services across 88 counties. There are 5 of us. We work directly with advocates at rape crisis programs, sometimes from advocates at dual or domestic violence programs, and they are burned out already. The pandemic only increased that, but advocates that have 100, 150 cases per advocate are not going to be providing the effective advocacy that we have come to rely on as this social service. So you're asking less people to provide more effective advocacy, and everything is just going to collapse, and none of it is going to be in compliance with Marcy's Law. So if we are going to have Marcy's Law compliance, and we're going to have these other statutes passing that increase the need for crime victim advocates, we need more money from the state. They cannot continue to rely on compliance simply by relying on federal funds that aren't there right now. And the third thing is we need our local municipal lawmakers, county commissioners, mayors, city managers, city council people to develop their own municipal funds as well, because they also benefit from this. And go to the state and go to the federal government and say, make this sustainable. This is not optional. And it's not optional because you created it this way. So follow through. We're not giving this to you for free. You need to fund it. And that is my main call to action in this moment, is make your voice heard. Call those federal lawmakers, keep calling them, send them mailings, send them emails, be present, and don't let them off the hook for this, because we need to have funding for this. And learn about the people who are running for office, educate yourself on where they stand on this, and, you know, exercise whatever rights that you have within our, our current system to make sure that the people who are supporting this are getting your support as well.
Thank you, Camille. And the last thing that I want to say before we close out today is also understanding the dynamics that even though the line items within our state budgets are increased, that is not a fix for Voca. Voca is a federal fix, right? So what has happened, even with the line item, Alicia, that was created for DV, the line item that has been increased for sexual violence, what we have seen is that, unfortunately, for the intentionality which those line items were created for, now they have to offset expenditures of Voca and operational and sustainability costs. So it's impossible. We're not asking for funding to substitute the other. We are asking, right, or to cover. We need Voca to increase and those funding deposits to be there, right, for survivors, so that we're able to provide the services. We need the Crime Victims of Act to actually be whole and understand, and the fundings, and to remove so much layers for survivors to receive the fundings that they need when they are filing their claims, right, in those perspectives. And then we need the line items for sustainability and for creation, and understanding that it is not acceptable that only one victim or no representative, no advocate is at any of the counties that we actually serve. That this is a multidisciplinary approach, that we do intersect in the work that we do, that we recognize that there is power and strength in the collective, but the time is now Ohio. We need to be heard. We need to be seen, but we need people to be mobilized and understand that the more our fundings are hindered, the inability for us to serve survivors becomes a hindrance of service. And we will continue to have an increase of crime and a lack of ability of providing a society and sustaining a society that can be healthy, sustainable, and what Ohio actually deserves. It's a cry out today. So my colleagues, I thank you for joining me today on a Friday afternoon. I thank you for your time, your expertise, for your experience and sharing the space with us. We will also be sharing a co-op that we are drafting all together, and hopefully we could continue to amplify this issue. So thank you for all of those that are joining us. And if you're asking, go to each one of our websites. You can still contribute, donate, express, continue sharing this video. The more people know, the more we can have this conversation, because words are important, representation is important, and now more than ever, we need to be able to embrace our voices and amplify that on behalf of survivors of crime in the state of Ohio. Good evening, stay safe, stay well, wear your mask, and practice social distancing. Take care. Thank you.